I went to school in Britain, so I know the National Health Service best. They have a subpart of the NHS called NICE. And what NICE does is it controls access. The other day, NICE put out an executive order, as we would call it, that denied cortisone and steroid treatments for all back patients in the UK under the NHS. Not because it was not good medical practice. It was to save the NHS 33 million pounds. I will vote in the Congress to make sure that never happens to you from the federal government. So, sir, I got you.
That panel does not have the authority to make decisions, does it? Only to recommend.
What we've seen across the board is a number of decisions by both Canadian and UK healthcare.
No, I'm talking about the U.S. I'm talking about the panel that the lady was talking about.
Right, yes. Right now, what the Congress is doing is has funded it, ironically, in the stimulus bill with $1.2 billion. I think what they've done is use the stimulus bill to establish the bureaucracy, and then under subsequent legislation, they'll put the bureaucracy on the road to restrict health care. That's the intention.
They're going to make recommendations on how to improve it, right?
As you have government health care, though, as everybody knows, government recommendations become mandates very, very quickly. Yeah, and I would worry that with the numbers that you've seen up here, the government will quickly run out of money in this program. And then the mandate will come down. As we've seen, remember, is there a sense of irony here that we're talking about expanding a government health care program as we are talking about a 21% reduction for Medicare? Shouldn't we honor the promises we've already made to seniors first?
Thank you, Congressman. I enjoyed your presentation, and I found it had many salient points. I like that you raised the idea of tort reform. I think, though, that, as this lady down here said, keeping insurance companies from getting between doctors and patients is equally as important as keeping the doctors. In your presentation, you did bring up the Brits and the Canadian system, but both of those are single-payer systems, and I think it's important to note that the administration is not promoting a single-payer system. They're promoting a public health system.
No, the rules apply. We're respectful to everyone.
I'm sure you did. Also, although there are shortcomings in the British and Canadian and European systems, we do not see people in those countries losing their houses or losing their life savings if they get catastrophically ill, as we see sometimes in the States here. And lastly, in terms of government getting involved, and I know we all have a fear of too much government going back a couple of decades here, but I think we've seen in the last 8 years that sometimes we didn't have enough government involvement. If you look at the meltdown in the financial industries in the last 8 years, it was because of the repeal. Absolutely. Clinton was involved with repealing Glass-Steagall. It was both sides of the aisle. But sometimes when we have government not doing its part, then a lot of these runaway things can happen, and the insurance industry, as we all know, is running away with control of the industry, and that's where I think we need to. People were deathly afraid of Social Security being introduced, and look how that's turned out. And people 40-some years ago were also standing up and railing against Medicare. And Medicare has been quite successful over the last 40 years. So, I think it's great that we're having this discussion, but sometimes, government, the post office runs relatively well. The military. Wait a minute.
I think you lost the crowd on that.
Fair point. Where else can you have somebody come to your house, take a letter from your house, and deliver it anywhere in the country for 44 cents? The military does do quite well, and we have the best military and the best fighting men and women in the world on the planet.
Obviously, it's an emotional point for me, but let me just say one thing, because we're mainly talking about healthcare, but we saw the Afghan elections this weekend, and our men and women in uniform in Afghanistan did an outstanding job. You raise a serious point, and I just want to address that one, that there is substantial bipartisan commitment to Social Security and Medicare, with a huge challenge ahead of us. What was the importance of last year in Social Security and Medicare? Why was last year a very important year, 2008? Because it was the first year that a baby boomer retired. And then we're moving into a roughly $30 trillion deficit for those two programs. I feel that we made a commitment to seniors through Social Security and Medicare, and we already don't have enough money for that. And we need to honor those commitments first, which is my view.
You've been very patient.
My name is Maureen Carson. I'm from Arlington Heights. My biggest question for you is, I like your ideas. I don't like the speaker's ideas. What can I do to keep President Obama from pushing through the speaker's bill and me just sitting here as a citizen not knowing what to do and being called a radical?
I would say on the subject of HR 3200, your work is done. You had me with the law, because I am not a supporter of HR 3200. Thank you. We have two senators, and I heard you. You know what? But to always have hope. Probably more directly, you have friends and relatives in other congressional districts. We have a number of representatives from Illinois who have not stated a position on this legislation. And being able to reach out to them and talk to them like you're doing here. I wish more of them did town hall meetings like we're doing, but if you can reach out to them, I guarantee you as a representative in Congress that over time the public voice is heard. A number of people say with these town hall meetings that they are manufactured, that they are something that has been designed in some room by one party or the other. My view is they are the voice of the American people.